A clinical trial leaves one person brain dead and others in the hospital.
Plus, if you love Chipotle, they will be closing down for a little bit next month. CBS 2's Lisa Sigell has more. Lisa.
Anyone freaking out right now?
No, I think I'm okay.
You're going to be okay. Remember that guy who stayed on the diet for like 186 days?
The Chipotle diet.
Chipotle diet? Yeah, he's probably freaking out right now.
Yeah, he might be.
Yeah, I'll get to it in just a sec, but a lot going on in the world of health today. Big news about sleep and age. The American Heart Association is now linking poor sleep with a higher risk of stroke and cognitive problems as we get older. Scientists found fragmented sleep, that means you wake up at least 7 times a night, can actually raise the risk of severe hardening of the arteries up to 27%. And guess what? The risk highest in seniors. All right, you see the commercials all the time. We even did that special report on clinical trials. You can make a lot of money doing them, even help others, but there are some risks. And in France, some people are unfortunately learning that firsthand. Medics rushed 6 research volunteers to this hospital in western France after they became violently ill while taking part in a drug study. Now prosecutors have launched an investigation. The French health minister says 90 people took part in the experimental testing that involved varying doses of an oral painkiller. The hospital says 1 person is now brain dead and 3 others have damage that may not be reversible. Health officials say it's rare for people to get sick when testing new drugs because researchers usually start with the lowest possible dose after extensive testing on animals. Now, the botched drug test happened at the biotrial laboratory in the city of Rennes. The French company specializes in clinical studies. In fact, the biotrial website says it has 25 years of experience with clinical trials. The French company also has offices in London and Newark, New Jersey. Now, we've just learned 2 more men are also in the hospital right now. We don't know their condition at this time. 90 men were in the trial. All were healthy when they started, so it's a little bit scary.
Oh, it's a lot scary, absolutely.
Yeah.
So have they released the name of this drug yet? Because earlier they weren't saying what it was or what was in it.
Well, a lot of times they actually just put a number. They never actually name it until after it's been approved. In this case, we don't know anything about the drug. There's been a lot of speculation. And another note, clinical trials are really important, of course, to getting new medicine out. So this is a situation very unfortunate, but we don't want to also, take away from the very important clinical trials that are being done.
Sure,
so,
absolutely.
Okay, Chipotle. I'm going to get to it. I don't want anyone to freak out over the weekend, okay? If you need your fix of Chipotle, mark down the date, February 8th. You got it? February 8th. That's when the chain will close all its stores for a few hours, maybe 4 to 5. Nearly 2,000 locations will be part of the closure, so employees can be part of a company-wide meeting. The focus, well, improving food safety, of course. One new step being taken, lettuce and tomatoes will be washed at a central facility before being shipped to restaurants. That's because they're at high risk of contamination in terms of where they're grown, the fields. Now, this all comes after a series of disease outbreaks, including E. coli, salmonella, and norovirus. But one thing to remember, Chipotle says in the last 2 months, everything's been good. They've been serving 1 million customers at a time.
All right.
There you go.
All right. This isn't.
Are you the spokesman?
It'll do.
No, that was good, Paul.